Good morning. How are you doing? Kenya's biggest conversation gets into the second hour. Today is the first day of October 2021. Welcome to October. We've been here for a while. If you're just waking up, we've been here. We know how October is. We can give you experience. Today is also World Smile Day. Not laugh, smile. Yes, like that.
That wasn't a smile. That was a grimace.
Wow.
A smile is incomplete if we can't see your teeth.
Yeah.
Says who?
Says I, the African.
Right.
Maybe show him. That's a smile.
Nice.
City, let's begin with today's proverb.
One does not use a spear to kill a snail.
One does not use a spear to kill a snail. Where is this from?
Depends on how big the snail is and how small the spear is. Okay,
Also
sorry.
depends. If you're holding a spear in your
And
hand,
there's a snail and you
there's a
wanted to
snail.
get rid of it. See, this is your weapon that you have available.
Yeah.
I've seen little tiny spears
Plus,
as well.
a spear can crush the
The skull of a snail,
The
isn't
shell is what
The
you're trying
shell.
to think of right here.
A
Yes,
snail.
yes.
Yes.
Okay, anything else you want
Don't
to say about the
step
snail?
on the snail.
Why did you guys just come up with your own proverb instead? And start with the shell of the snail and the spear. Okay, that's the headline of the proverb. Then you have three versions of it.
If you're holding a spear and you see a snail and you want to kill it, kill it.
If you see a snail and you're holding a spear, that's how you start. Okay. If you have a spear and you see a snail,
Kill it. That's it. Let's smile anyway. We are joined in the studio today to have this conversation about World Smile Day by Dr. Martin Kamau. He's a founder of Belarissa Foundation and also a partner with Smile Train. We'll also be joined on the line by Damaris Mwende, who is a former patient and a beneficiary of the work that's done by Smile Train. Welcome, Dr. Kamau.
Thank you very much.
Now, let's start by understanding what is the Belarissa Foundation, and then you'll tell us about Smile Train.
All right, so Belarissa Foundation is an organization, it's actually a local organization that was formed by like-minded individuals. So the idea of forming Belarissa Foundation was to provide what is known as last mile services, right? So basically, this means a group of medical volunteers will go out into the regions, these far regions, and then give their services to those patients. These are patients who may be less fortunate and are unable to reach what are known as the major city centers, all right? What is interesting about Belarissa Foundation is when we formed it, we were committed as medical volunteers, etc., to provide some of these services for free. So Belarissa Foundation specifically deals with the management or with the provision of services to patients who are afflicted with cleft lip and palate. All right. So that is what our core area of expertise is. So all our medical personnel are geared towards those provision of those services.
Sure.
That means now, if you remember what I've said, we provide free services,
Yeah.
and we usually go to where the patients are rather than wait for the patients to come see us. That means we have to leverage partnerships. And that is where Smile Train comes in, all right?
Okay.
So Smile Train is the largest cleft organization in the world. It's based in the US. They're very big, or their main core area is to enable the provision of these free services or treatment of cleft patients all over the world.
All right.
And their key mandate is to ensure that wherever they're doing it, the service is provided free. So they're the largest in terms of getting the funding and providing this funding so that the programs that are done, and usually they're in mainly third world countries, can be sustainable in terms of providing it free. It's very difficult if you're sitting here today for you to go to use your own money, travel, then try and treat. It becomes unsustainable.
Right.
And so we have to leverage some of those partnerships.
Right.
Sure.
So essentially you're saying that the recipients of this service receive it for free.
Yes. Free. They walk
Yes.
in and walk out.
Yes, but the service has a cost.
Yes.
So how do you fund it?
Now, that's the thing. Like with any organization, you have to have partnerships. So the way we do it ourselves, or the model that we found that works, is like a private-public partnership. Now, one of the key things that I want to highlight is that, remember, it's like-minded individuals. So for me, let me just put it this way just before. I always thought, what was the best way to give back to the community? I can give money, you can donate something.
Yeah.
But I found that for me, I've been very lucky to reach where I am. I am a specialist in oral and maxillofacial surgery. So I'm lucky to reach where I am. So I found the best way to do it is, why don't you offer your service? All right?
Yeah.
Because if I'm to charge it here, it will be quite expensive. So we have to kind of volunteer. That's number one. So you
Okay.
reduce cost. So I won't charge anything, all right? And the other medical
You've said
volunteers.
kind of volunteer.
Not kind of, we volunteer
Okay.
to give. So now, that means I'm not charging the patient, right?
Yeah.
Number two, we have to now request, for example, from partners like Smile Train. So people who are like-minded, we've got the same kind of goals in mind to provide this free service to these specific people. So what we do is, look, we'd say we're going to a place. I would probably expect to use this much in terms of transport, food, accommodation, etc.
Okay.
Sometimes even the organizations go as far as, we may reach a center which has got only the services, the hospital that is capable of doing it, but the patients are still far.
That's still far from.
So you need to bring them. So they are able to do that for us to bring
So they
the patient.
transport the patient
They
to
can-
the facility.
They can transport the patients to
I
the facility.
see.
So they'll provide the funding, but you have to do what? Kind of a budget.
Yeah.
But it has to be a reasonable, obviously.
Yeah.
Number three, we also have to leverage now what we call public. We have to go and talk. You know, when you go to a hospital, usually we use the public hospital. So we have to engage the public facilities. And usually for us, like in Kenya, we engage now county governments and the county health facilities. So now we'll go to the county health facility or the county government, talk to maybe the Minister of Health,
Yeah.
etc. And then from there, we give them what is our vision, and then we ask them, please, now can we use your facility? We've been very lucky to have, when we interact with a lot of these county governments, they're very excited about some of these, should I say, programs that we're doing.
They're
And it's
receptive.
Very receptive. And remember, these are free service. So if you're giving a free service, people are receptive to it.
Yeah.
So what happens is that they will offer you the facility. Like, for example, you'll go to the county health facility, county government hospital, and use the facility for free. So literally, you'll be admitting the patients to the wards. They don't pay.
Right.
You'll use their theaters.
Right.
We don't pay.
Right.
And they're even more gracious to give the staff. I mean, with the staff,
nurses
staffs
and all.
who can help us as part of this organization to do it. Remember, we can't all go 50 people. We have to go a small team, but we have to also
So you'll take
utilize-
the expert, like Dr. Kamau,
Yes.
the maxillofacial surgeon.
Yes.
But you don't need to carry a nurse from here because you'll
Exactly.
find a nurse at the
Exactly.
county facility.
Exactly.
Do the counties also give you the consumables, the gloves, the whatever, everything else?
Yes. Now, because for us, especially with cleft lip and palate, there's some specific things that we need, specifically to treat these people. So sometimes we do part.
Okay.
So we'll come with most of the pharmaceuticals. We usually transport them because we know what we need. And sometimes when we realize, when you go to some places, you may not find what you have. And so you end up having a gap and a problem in terms of whatever provision. So what we do is we ask the hospitals, do you have this? They tell us what they have. Whatever they don't have, we plug it in, of course, using our partners.
Right.
So that by the time we're going on the ground, we have everything to run it efficiently.
Right.
So is this a full-time job?
No, it's not.
So what else do you do when you are not volunteering your time?
All right. So I'm also a lecturer based at the University of Nairobi.
Volunteering as well?
Well, no, that is not a volunteer. So I do lecture. So in the Department of Human Anatomy and Medical Physiology in the University of Nairobi, just here in Chiromo. So I actually do teach also undergraduate
Right.
students. So I'm trying to bring up the.
So you're a lecturer. You're also
Yes.
practicing
Yes.
as a maxillofacial surgeon.
Yes. So the university accords us what is known as part-time private practice. So it's at the same time, like for example, you can do some of these things like on the weekend. You can go and do some part-time private practice to augment. It is also at the same time that you can plug in and do your volunteer work.
Okay.
Right.
Yeah.
So, I mean, by the time we're talking about building, these loads where you're going into different parts of the country to work on these patients, that means that there are a lot in terms of patients who need this help,
Yeah.
who have cleft lip, cleft palate. Are we seeing that there's large numbers of people in the country who have this, children, adults, that need this attention? What now is the profile of the country? Because it seems as it's been there for the longest time. It's been around, people still being born with it. The makeup of this particular condition. and in terms of the numbers around the country? What are
Well,
looking
we
at?
do get them. You know, the funny thing is when you're dealing with like this specialty, you might walk around in the streets, but you may never see a cleft patient. But now when we go in and they know that we're providing the service, now is when you start seeing the patient. Yeah, you start seeing the patients. So the statistics will always be there. For example, cleft lip is every birth, 1 in 700 live births. So you expect for every 700 births, you'd be expecting 1 cleft lip and palate. All right? So these are kind of the expectations. So do we see them? Children being born? Yes. Interestingly, we also do see even adults or teenagers coming for treatment. That means this person has been walking around for 15 years, 25 years, 40 years with that affliction.
So you get it at birth. You're born with it.
You're born with it.
You don't develop cleft lip.
You do not develop it.
What-
You're
what
born
causes-
with it.
What causes it?
All right, now there are many causes. So let me put it this way. In a nutshell, it is what we call multifactorial. So they're genetic and they are what we call environmental factors. Now, I will tell you this. When you hear something like multifactorial, it would tell you that there's not an exact cause. Somebody can say, look, come here, this is exactly what's going to cause. No, they're multifactorial. So I'll give you an example. Genetics means you can't find some genetic anomalies that will predispose you to a cleft lip. All right. So these are what we call syndromes. So you'll find in a family or a person afflicted by a certain syndrome, they'll get a cleft. Now, what do we mean by environment? All
in the mother's womb.
Exactly. So as you're developing, something is happening. So maybe the mother has got some comorbid factors. Maybe she's a bit sick. Maybe she has got diabetes. She's immunity issues. She's a drug abuser, alcohol abuser. Maybe takes some medications for some conditions like some anti-epileptic drugs, etc., smokes, all these things. This can be contributory. We're not saying that they cause, all right? So these are clear factors, but they are considered to be contributory to what? The development of clefts. Now, if you bring those together, another thing I forgot, and you may notice a lot of times we go to hard-to-reach areas. Usually these are low socioeconomic status. So a lot of factors also involved are those of nutrition. So you find maybe the mother is not, that cannot afford the right types of food during pregnancy, etc. So then you don't have the right nutrients, etc. So the development of the baby might be abnormal. Or I'm not saying it is abnormal, might be abnormal. So you can be predisposed now to those, to cleft lip and palate. So all these factors coming together are the ones that now can predispose you to get a cleft lip. But it can occur, boom, just like that.
Just like that.
Boom, you can still get it.
But if you look at the prevalence
Yes.
in terms of that demographic and the profile, is it more likely that you'll find cleft lip cases in urban areas or in the rural areas, in socioeconomic status? Is it in well-to-do areas, in average areas, or in poor households?
Okay. From what I've told you, the factors, it will be more likely to be low socioeconomic status, and usually that's more rural.
Yeah.
That I mean urban, they're not there. But that's our strata. Low socioeconomic status, rural, just because of the environmental factors that are there. Interestingly, you can still do, because of this quote-unquote genetics, you can even still plug it in between male and females. Cleft lip and palate combined, or cleft lip is more common in males. Cleft palate alone is more common in females. Interesting. The reason, we don't know.
Difference?
Cleft lip.
Lip, palate.
Very good. Thank you for at least that one. Now we can describe it. So let's say a physical description. Cleft lip is when now you have that gap on your upper lip usually. All right? Upper lip. So you have got that gap. So when you look at somebody, the right and left sides are split.
It's like it is not fully formed.
It's not fully formed.
Right.
You can't even pass your lips. You can't even hold air in your mouth like that, right? So there's a gap. And usually it extends from the nose inside onto completely where you put your lip balm and everything.
Yep.
It cuts all through. That's cleft lip. When you're talking about the cleft palate, it will extend to where your teeth are, the gum.
Protruding.
So remember, you're saying you want to smile and see all your teeth. So when
Yeah.
somebody smiles, you'll see a gap there. Usually near the what we call the canine, just on the side. Then it will extend to the roof of the mouth. That's the palate. That means you have a communication now between your mouth and your nose. The roof of the mouth separates the mouth and the nose. So you can imagine all the problems that are associated with that.
I'm trying to imagine babies born with either, whether it is cleft lip or whether it is cleft palate, and we're looking at nutrition being essential for a child, newborn, having to suckle. Must be a nightmare.
It is a nightmare. Yeah, in fact, that's one of the biggest problems we have, because when you get these babies and want to treat them maybe at 3 months, the ideal age for cleft lip, they are always underweight. Now, the thing is, there's a way, this is good for maybe, should I say, public health in terms of how to feed them. There's a way you can feed them so that they are able to get in adequate milk, breast milk. So let me just put it this way, at least so that the viewers can hear. Usually, the problem with now cleft lip and palate is that you are unable to suckle. The baby is unable to suckle, latch and suckle properly. So when the mothers try to feed them, when the baby is suckling, not only is the milk going in, air is going in as well. You know, when they latch and give a vacuum, it's the milk that's pulled into the mouth, goes into the stomach. With the cleft and the gap, when the baby tries to suckle, yes, there'll be some milk being pulled, but also what else is going in? Air. So what happens? The baby becomes full, having taken maybe half of the milk. The rest is air in the stomach. So what we encourage is more frequent feeding. Sometimes we don't, if the cleft is too wide, we encourage maybe spoon feeding frequently and frequent burping. And the baby has to be upright. Because we know what's the problem? Too much air going in and keeping them,
So the work that you do around the country as Bela Risu Foundation and then as a Smile Train
partner,
partner of Smile Train, is this what we see as Operation Smile campaigns around the country, or are those done by different organizations?
They're different organizations
right.
That do it. Operation Smile was kind of the first organization to start doing cleft lip back in the 90s, 1980s, 1990s. So they really did a lot to kind of come in and plug that gap. Because at that time, there was basically no organization. You can imagine the 80s were still building up the expertise in terms of education. So they came in that time. Now, a lot more organizations have come in to do this now, this specific type of interventions.
How many people do we have in this country who do what you do? Not in terms of volunteering, who are trained
as
in this?
Oral maxillofacial surgeons.
Yes. Now, this is the thing. There are not too many. The reason is, even as an oral maxillofacial surgeon, the people who are qualified would be anybody who is doing surgical expertise. This is a surgeon who is doing surgical expertise in the head and neck area. All right, that would be few. Maybe maxillofacial primarily, could be ENT, could be plastic. Now, the thing is, you can be trained. Even I was trained as a maxillofacial, but I still needed to do some extra steps or extra training to do a cleft. So this is what we're going in terms of our healthcare. It's called super specialty training. All right? That's where we're going. So when it comes to the people who can do cleft lip and palate in Kenya today, actually there are not many. There are quite few. So another thing that we've been doing...
100, 10, 15?
100 is many.
100 is many, actually, So maybe it'd be talking, I don't know, maybe 30, 40. But I can't give you an example. That number is just to show you that they are not
just an estimation.
So another thing I would like to mention in the same light is that with Belarissa Foundation and Smile Train, one of the other key areas that is focused is education and training. Yeah, so if I'm doing cleft, I am a specialist. I can invite people who are interested, maybe surgeons, to come and start learning the skills, because they'll get the patients there.
So how many have Belarissa now been able to bring on board?
Who?
Like experts on this?
People
whom you've trained, maybe who are ENT specialists before, but they did not have this specific expertise.
Well, Belarissa has been relatively young. It was formed just a few years ago. So we were formed, initially when we were formed, our primary goal was primary care. I mean, primary, just go and give the service, but now we're transitioning to now training, because the idea is you can't keep on going to some of these areas and coming back. What you want is when you go to those areas, you train. Now, the reason I'm saying this is because we also travel out of the country sometimes. So that's the key. So for now, we are trying to bring in the students to learn, or the surgeons to learn. We have been able to train a few surgeons. They come plug in, then they go back. Usually they're sent in, for example, by Smile Train, and they're usually from other countries, for example, South Sudan, DRC, Congo, etc. So we'll train them, then they go back here.
Right. So the thing about this, and we've seen hundreds of people whose lives basically have been changed because the surgery is a solution. It sorts out that problem. Yeah. Many would wish that it would have been sorted out earlier.
Yes.
The basic surgical miracle that then is done on children then allows them to, feed properly, communicate properly, etc., etc. Now, the surgical intervention being the cure, and when we look at things like prevention being better than cure, is there any form of prevention from some of the factors that you've talked about, or things that families can do to kind of ensure that you reduce the risk of this in case? Do you see? I don't know if you see where I'm going with this, because we've talked about there's certain factors that would influence whether mothers could then pass it to their children.
Yeah.
We've talked about, a status of certain things, poor nutrition, immunity issues. Are there things that in the education arm of what you are doing now, you can start to give that information to people who can say, well, look, here are certain factors that we can try to determine that could influence in one way or another. These are things we can take into consideration. Does that ever come up, or are we looking at hard, fast surgery as a solution? Should it come up?
That's excellent. But like in anything in medical, you can't do it. It has to be multi-pronged. So that's a very good question, yes? So the patients who are there had fast prong. We have to treat them. Now, when it comes to the mothers, these are mothers, if it's a first baby, she's probably going to get second, third, or even the community as large. You'll give them community education. And you're right, you go, those factors that I've told you are the ones that you go to, the associated ones. It's not that if we go through each of them and everything is ticked to the box that they won't get clefts, but at least they will have reduced their chances. So we go through all those.
Okay.
So we'll go through the exact factors that were discussed, all right? Like avoid smoking, don't take any drugs, don't take any alcohol, etc., etc. And then obviously have good follow-up and good nutrition. So those are the things we'll tell them. And then now, like with everything in life, you just have to hope for the best and pray. That's it. When the baby is born, if they have a cleft, they should not worry also, because there is expertise to deal with it.
Right. One of the people who've benefited from Smile Train work is Damaris Mwende. She's on the line and she's joining us now. Good morning, Damaris.
Good morning.
It's good to have you on the show. Thank you very much for joining us this morning. Just to do an introduction, then we take a break and then we'll be able to have a deeper conversation with you. Where are you this morning, Damaris?
I am at home without feeling.
Sorry, we didn't get that clearly again.
Muthui.
Okay. So this is one of the beneficiaries of the Smile Train program, and she'll tell us about her journey going through this whole operation, living with cleft lip and cleft palate, which of the two that she went through, and then the service that she got from Smile Train and the work that then is done, and then the impact that this has had on her life. Today is World Smile Day, the first day of October 2021. Damaris Mwende is somebody who had a cleft lip and cleft palate. She'll tell us which is which, but she got through an operation. She went through an operation conducted by Smile Train volunteers. Damaris, so at what age did you undergo the operation?
17 years.
You were 17 years old at the point.
Yeah.
So before the operation, just tell us how your life was living with a cleft lip.
That time I was
Hello, Damaris.
Yes.
Yep. So what kind of difficulties were you having when you were living with a cleft lip?
I was like lonely.
Yeah.
Children were not staying with me.
Did you have any friends?
What?
I'm asking, before the operation, did you have any friends?
Not many.
And so when you said that people did not want to play with you, so what did you do most of the time when you were in school?
I was staying out.
Okay. And once you had the operation, was there change in the way people related to you?
Yes.
So did you get more friends?
Yes.
When you had the operation, did you go home on the same day, or did you have to stay in hospital?
I stayed at hospital.
Okay.
Yes.
And when you went home, Did you start eating as normal? Did you start talking as normal? How was it after the operation? What happened?
I take some days to treat. Treat as normal.
Okay.
And today, Damaris, ukitoka kwa nyumba, ukienda kwa duka au ukienda kuongea na marafiki zako, how does that make you feel? Siku hizi uko na confidence ukiongelesha watu. Na unaweza cheka na watu sasa.
Ulikuwa unaogopa kucheka hapo awali
Hawa madaktari wa Smile Train, ulijuaje kuhusu hii operation yao? Nani alikuja kukuambia?
Ni wazazi.
Ulipelekwa kwa hospitali gani?
Wote. Kweli mfunzo ya wote.
Walikuwa wamekuambia kwa nini unapelekwa hospitali?
Na ulikuwa unaogopa ulipoambiwa utafanyiwa operation?
Sikuogopa.
Aha, sasa wewe ni wale watu tunaita brave.
Sasa uko na miaka ngapi?
Niko 19.
So umemaliza form 4? Unafanya nini sasa?
Sasa niko hapa nyumbani.
Na wewe ulipokuwa uko skulini ulikuwa unatarajia unaweza kufanya course gani?
Beauty and Bela.
Beauty and therapy. Kwa nini?
Hiyo ni career yangu.
Ni kitu roho yako imependa. Na tuseme kwa mfano ukikosa kupata hiyo ungependa kufanya nini ingine?
Sidhani ingine.
Okay.
Ni hiyo tu.
Okay.
Sawa, Damaris, asante sana kwa kuzungumza na sisi.
Sawa.
Endelea kusmile.
Na usmile, salimia wazazi wako na ndugu zako na dada zako ukiwa nao. Nawaambia tumewasalimia sana.
Sawa.
Asante Damaris. Well, this is somebody whose life has changed. And then she looks back and she now has the confidence to even look at the career that she'd like to take up. Only that, I think, just from listening to her, it's the opportunity that has not presented itself. She's finished high school. She's waiting for the next step. She doesn't know now, do I go to college? Where do I go to actually get the skill to practice my trade?
Right. From your end, I mean, I don't know how much time you have before you perform these surgeries on these patients, time before the surgery and then time after. But for you, what can you see as what changes essentially in their lives before, and then what does it then do in terms of whether it be an emotional boost or a validation for the work that you do?
This from my side or the patient?
From your side.
Okay, from my side is you get satisfaction in terms of giving the service back. But I think what you see, what is most striking is the emotional reaction that you'll see either from the parents or, for example, from Damaris, from her herself. One of the key things we take a lot of photos of the patients pre-operatively and post-op. And sometimes you can even see it in the eyes. When you take a photo of this child before and when they're treated and they see themselves, and then you just stay a bit of time, then you take the photo after. There's a change. It goes. I'm telling you, it's amazing. The emotional reactions from the parents are even more dramatic. You just find somebody just gets a baby the first time and starts crying. I'm telling you, it can be a dramatic scene when from before where always you find a group of patients seated there. Then they're all encouraging themselves. Maybe somebody's coming for a cleft palate repair, the parent, and they've done the cleft lip. Encouraging the first-time parent, you don't worry, things will be okay. Ours were like this, they've been repaired. Look, now we're happy. So the parents are more comfortable when they see the baby after, especially after all the trauma they've gone through. Because I think a lot of the parents also have a lot of not even their own issues. The relatives come.
Everybody.
It's
Right,
chaotic.
everything is
The society is basically looking at
Society,
you. What
yeah.
did you do to the baby?
Exactly. They're blamed sometimes, the mothers, and they hide the babies
Yep.
even. So you can now, when you get a baby now, everything seems more normal.
You can present this baby in the open.
I'm telling you, small things make a big difference.
Sure.
And one of these things is that just that repair of a cleft lip takes only 45 minutes, and it's life changing.
What?
It'll take 45 minutes to do. For me, I'll do it. It'll take me.
And the
40
patient will go home the same day?
Yes, usually they'll come in the morning. We have to, if they're children, we have to monitor them
Okay.
because the most important is they're safe. So we keep them in the ward and they go the next day in the morning. Safety is important. This is an elective procedure. We don't consider it emergency.
Okay.
So we have to plan for them. The most important is the baby goes back to the parents. Yeah.
Now, this 45-minute operation, how long did you take to train to be able to do this thing for 45 minutes?
So I spent my undergraduate maybe 5 years. Postgraduate I did another 4 years, and then I went outside of the country.
How many years? I'm counting.
So undergrad, you were doing just the normal
Just the
medicine and surgery.
You do the normal. I did dentistry.
All right, dentistry.
Yeah, so I
and then
finished.
after that,
I did maxillofacial surgery. So I did it over my span of 4 years. Then I've been going outside every time. So I do short-term fellowships. So I was in India to do a small
So
clinic.
cumulatively.
10 years.
So you trained 10 years to do this 45-minute procedure.
Yeah.
Okay.
Well, well, you can do a little bit more.
right, it's continuous. By next year, we'll be talking about 11 years.
You know? Yeah.
What is the cost of getting one person who's an expert on what you are doing?
Cost. Now you can imagine.
Let's just talk about we are done with the basic degree. We have done with the secondary degree, and now what is it to get this special? What did you call it? The super expertise.
Yeah. What is the cost?
Yes.
It depends. If you're to go abroad, I mean, you can imagine do a cleft, doing a fellowship can cost you maybe $2 million, $20,000 or something, because you have to pay, do your upkeeps, etc.
Right.
for you to do it.
Right.
This is after the university, where you also have been paying for post-undergraduate and postgraduate. So the cost is enormous. Yeah.
Because I'm looking at this and just looking back at, for example, Damaris stayed for 17 years with that
Yes.
condition.
Yes.
Obviously, she was being taken to hospital. Obviously, healthcare workers, doctors would look at the child and know what the problem is, but they also know that there's nothing much that they can do. For all these years that we've had these conditions in the country, hasn't there been a way of saying we shall then develop or train experts in this incrementally? Or we shall set up a facility, let's say at the former provincial hospitals, where we can be doing these operations? Because why did she have to live for 17 years? She's going to hospital, she's going to school. Everybody can basically see what the issue is, and everybody knows this is a minor operation surgery.
Well, it's not minor.
Well, okay,
just
not
a
minor.
short.
It's a short. It's a short. It's a short time surgery.
That's a very good question. But it also depends. It's called baby steps, and it depends on where the country has come from and where it's going. So it depends on what your priorities could be. So maybe it was primary healthcare, focusing on communicable diseases, non-communicable diseases, cancer, etc. So there's that focus. So now if we have been focusing on HIV, AIDS, malaria, etc., and these are big things,
Yeah.
you can imagine some of these other things can get neglected. So actually cleft falls under what is known as, this globally, surgically neglected diseases, all right? Small things where people fall through the cracks because maybe people will see that for the number of clefts that are there, we won't really focus on those training first. Let's focus on this HIV, AIDS, malaria, cancer, etc., which are the pillars. And it's a very logical way to do it. But like I told you, it's baby steps. And as our healthcare system matures, that is where we're going. So actually, what you've done is to preempt kind of something, because we're going into the super specialty area. So more of us are being trained. More of us are going to our own small areas. And so those units that you're saying, why have they not been developed, are being developed. But I think it's called the progression of healthcare development in any country. And that's where we're going. It's just that might take some time.
But I'm often puzzled myself, though, because the consensus on the preventative approach to healthcare is should be lauded, yet hardly practiced, especially in this country. Why? Because the super specialists are necessary, I understand.
Yes.
But most diseases that take people to hospitals can actually be prevented.
Yes, it's quite true. A lot, it depends on where the focus is. Prevention. A good thing, think about how COVID era, when it came in, a lot of the hospital numbers went down. It's not that hospital numbers went down. People actually
They were afraid to go to
hospital because
Yes.
they might contract. So, sometimes prevention starts with you. It starts with the individual. It's not starting with the healthcare worker. You know that if you're going to smoke, you're going to drink, you're eating a lot of red meat, blah, 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 or unhealthy diets, you'll develop some conditions.
Wait, did you say red meat?
No, not red meat. That's sorry. Nyama choma simba, by the way. So I'll just say. Unhealthy diets, all right? Maybe fat. There's a way you can do it. Maybe you don't have a balanced diet. So thank you for that correction. Balanced diets, etc. You know you're not doing yourself a favor. And so prevention starts with you. That's how I would approach it.
Okay. So, as you're talking about development of these super surgeries, for example, so what would it cost if, am I safe to say that most of the cleft lip, cleft palate cases in this country are taken care of for free by partners, most of in those areas? So if somebody were to walk into a medical facility, how much would it cost on average to have that done for yourself?
Interesting question. Again, multi-pronged. I'll tell you, is it a public or private facility?
Okay, tell us both.
Both.
Hey, no, I can't. Public facility, if you have got maybe NHIF
Right.
and the government, which is trying to implement UHC,
Yeah.
probably it won't cost you much, just maybe what you'll be paying to NHIF, etc. Yeah?
All right.
And maybe to buy, if there's no staff, maybe you augment to get the necessary things. If it's a public facility, that means you have to pay the surgeon, anesthetist, hospital. Private, sorry.
Yeah.
Even a private facility, it means you'd have to pay, this in Nairobi, you'd have
you're
to pay
paying
the surgeon
You're
fee.
paying Dr. Kamau.
Yes.
You're paying
The anesthetist.
Anesthetist,
Yeah.
you're paying the hospital,
Right.
and you're paying the hospital. You'll pay the medications for in and out. as
And
you leave.
all the surgical
every
materials,
every
gloves,
consumables.
syringes, etc., etc.
Everything.
Every single thing.
It can go, on estimate, from what I've seen, you'll probably be doing maybe, depending on the hospital, 350 to 500,000.
For the 45-minute surgery.
Yes.
Right. Okay. So then this is why it makes sense, because then segueing from that question and saying that making it priority, even though it is elective and not emergency, but necessary to see life. Because, if you're not able to feed properly, if you're not able to communicate properly, and then the more aesthetic thing of not being able to be comfortable in terms of how you look then affects your mental health. There's so many things that come as a result of this. We can just look at it as cleft palate, but the circumstances that it would then cause later a lot, probably more than can be dealt with. We're looking at a mental health crisis in this country, things that come with the way you look, and then you're not able to control that, going deeper into mental health issues. Perhaps then it's something that ought to be looked at. Looking and talking to somebody like Damaris this morning who says, well, you know what, I didn't have any friends. Can you imagine what that did to her psychology for 17 years, right? So even as we look at it, then probably taking more center stage in the future, then is it not something then that should be then established permanently in partnerships to say this is absolutely something necessary that needs to be done?
By the way, you've hit the nail on the head. Now, I'd not told you about what I quote-unquote would call the cleft experience. When you're dealing with the cleft, it's not only the surgery, cleft lip and palate. You'll do the surgeries at a certain point. You have to think about the feeding, nutrition. You have to think about the psychosocial aspects and support for the family and the patient. Those are crucial. Mental health is a big thing. All right. So Damaris is 17. All those years will definitely affect how our outlook is to change. Even if the cleft lip or palate has been repaired, her attitudes of how she interacts with people is still the same. And she carries it forward. Even if people treat her differently, she'll carry that same stigma forward. And that is one of the biggest things. Cleft palate is even worse because it affects speech. So somebody would talk like what we take for granted. You can hear me very well, but they would talk with a nasal, how are you? Hi. One of the worst things about such intonations is people naturally assume. First, you can't communicate, and naturally assume you've got a mental issue.
You have a developmental issue.
Let me tell you, it becomes a problem even in your own psychosocial mobility, upwards, even everything, psychological, social, even getting jobs is difficult. Because if I was to ask you in professions, how many cleft people who have been repaired, have you seen here, maybe producers, lawyers. How many have you seen? It's not that they're not there. Where are they? So this psychosocial issue and mental health is a big thing. It's some of the things that we're trying. It has to be holistic when you treat somebody. It's not just a cleft and say bye. No?
Right. So how do you do it? How do you do this? How do you offer this support?
So we do have now volunteer psychologists who come in. So they have to chat with or have a talk with the parents before, just to see how they're doing, encourage them, and then talk to them after, and then keep on having contact with them afterwards. So the psychologists have got now their way of handling it. And even with the psychologists, they have to have that, they need the cleft experience and all that stigma. So they have to now really talk to the parents and the children afflicted and trying to get them out and give them the confidence boost. So you have to have a psychologist on board. A lot of these were not there, and you are right. So it's a big mental health issue. Even today, we still have gaps because we don't have, again, those too many psychologists in those areas. So these are things they're trying to build up as we move forward. Yeah. So these are, should I say, a work in progress? Yeah. But it's something that we are aware of, and we are working hard to make sure that we can plug that, should I say, that gap.
There's a question I have to ask. Awareness. As you have partners who are already providing, in some cases, healthcare in the places you go to, is there any attention that is given to awareness so that people can understand, one, that there's help, B, the psychosocial support that you mentioned, it's not just for the child, it's also for the family that this child comes from?
Now, awareness, let me put it this way. There are gaps in giving the awareness, definitely, which we're trying to have. But I don't know. I also found that there are also gaps in terms of just some cultural issues where people might not be willing. The parents a bit hard in terms of even wanting to come. They don't see like they have a problem.
Usually it's defensive.
Very, yeah.
And it's not even cultural. No, it's defensive. You see, when I say ignorance sometimes masquerades itself as something very, very interesting. And poverty now is an even bigger hindrance, because if you think or feel that there's a cost attached to it, and you have a problem of simply existing, forget living, how do you think you're going to approach the whole thing? That's why I asked about the awareness, because if people know, then their response will be different.
Yeah.
Yes.
Exactly. Well, we're trying to leverage the awareness of the availability, right?
Yes.
We're talking about availability.
Availability,
Yeah.
yes, is fundamental.
The solution is available.
So the way we do it, to be honest, is that, yes, there'll be like Smile Train and other organizations trying to pump out the availability, like on a day like today or even any other day. We do the same, but ours is a bit more specific. We will go to on the ground, create awareness. But I think for us, it's more of the patients. When they see that this can be done, a lot of the patients will have had issues of going to the hospital, coming back. Yes, it can be done, come at 3 years, it can be done, disappointments.
Yep.
So some of them just want to come and see, can it be done, and then take it back. And so the awareness is there. Some are very skeptical. So we'll do the awareness, but actually be on the ground to do it. Once you do it, it changes. It's no longer just word of mouth. It is actual. It trust me, it changes. And so it's like anything. If you go to a hospital and they advertise, oh, they'll do this. They've never done it. People are skeptical. But as you keep on doing it, people develop a confidence. And that's how awareness is should I say, positive feedback? You keep on doing it, create confidence in that community, and that community spreads the word. It becomes now a positive feedback on it.
It's actually a very effective way of sending a message.
Yeah, I found it to be literally almost the best way.
So what kind of support do you reach out for members of the public?
For
As a
members of the
foundation?
public, I would say, there should be awareness. We hope that they get to know more about us in terms of reading. We do have a website, etc. They can take a look at the Instagrams, etc. More often than not, is just one, preventative, take care of themselves. Number two, in case of anything, let them know wherever they see a cleft patient that this treatment is available and can be offered at the earliest opportunity. So if the baby is born, they should be able to reach out to whichever organization, ours or any other organization, and so that.
And there are many organizations that are
Yes, there are many organizations trying to plug this gap, bridge this gap, should I say? Yeah. So for the public, don't be stigmatized. Number one, don't stigmatize them.
Do you have resource mobilization locally? like fundraising, if people would like to support you by just putting money into a kitty?
No,
Eric usually supports such causes. That is why he's asking.
fantastic, Eric.
Yes,
That
sir.
is excellent.
My philanthropy arm is
The philanthropy. Oh, that's fantastic. All right. Not as yet. Yeah.
Why not?
It has been restrictive. We've been primarily working through our international partners.
Okay.
It's probably trying to get an effective way of doing it. Like I told you, we're relatively young
yeah.
in this. So we're also taking babies. I mean, growth also comes with this. Sometimes advice from possibly like you, who is more in that space, would be very welcome. So we're also open to a lot of advice, to be honest, because I think it's through many people coming together and the ideas that we will become better. Yeah.
Thank you very much for joining us today, Dr. Martin Kamau.
Thank you for having me.
Now, your final word as we celebrate this World Smile Day.
Okay, final word. Today, as you go out, make sure that every person you meet has a smile. That was the main aim of World Smile Day.
Make sure that they have a smile.
Make sure that every person you meet smiles. Harvey Ball was the guy who created World Smile Day. He's the one who created the smile emoji in 1963. The smile emoji you have was created
Right.
for a company in the US, and he didn't know. He didn't even patent it. In the 2000s, when he passed on, a foundation was set up, Harvey Ball World Smile Foundation, and they created this World Smile Day for you to create that emoji, for you to create a smile. So today, whoever goes out, make sure whatever you say, please, that person has a smile. That's it.
That's awesome.
So make
Thank
somebody
you.
smile.
Make somebody smile today. Thank you.
All right. Let us always meet each other with a smile, for the smile is the beginning of love. Keep smiling because life is a beautiful thing. And there's so much to smile about. You see anything to smile about? Our friends and Vibes are playing that song today, I'm sure. Thank you very much for keeping locked in on this conversation. It's World Smile Day. Have a lovely smile and a very good day to Dr. Martin Kamau, founder, Belarissa Foundation, and this foundation partners with the Smile Train. It's a global foundation as well. Asante sana, Doc.
Thank you very much for having me.
This is the Situation Room, the only way to start your day.